Over the months of March and April 2025, Matt was diagnosed with not just one, but two rare conditions. First MALS, then HSP. He already shared in separate videos about his experience getting those diagnoses and getting treatment for them, but I wanted to share more about the conditions themselves. I spent a good amount of time learning about these conditions throughout the whole ordeal, and objectively it's kind of interesting, the rare and weird things that can go wrong with the human body. His first diagnosis was MALS, which stands for median arcuate ligament syndrome. The median arcuate ligament is one of the pieces that holds your aorta against your spine, just under your diaphragm. Just below that ligament is your celiac artery and your celiac plexus. The celiac artery is the vessel that branches off from the aorta and carries blood to all the organs in your abdomen. And the celiac plexus is the bunch of nerves that carries signals, including pain signals, between your abdomen and your brain. In most people, the median arcuate ligament is above the celiac artery and celiac plexus, where it's not impinging them at all. However, in a portion of the population, that ligament is lower down, where it's compressing both the artery and the nerves. Interestingly, that portion of the population is somewhere around 10 to 30% of people, and only about 1% of those people have symptoms of MALS. The reason there's so much uncertainty in the number of people that have this anatomical condition has to do with the sample set. Only people who have some sort of symptoms are going to go through the process of getting that CT angiogram that's needed to identify MALS. What causes the onset of MALS symptoms isn't well understood. It's thought that the anatomical condition is usually present from birth, and yet most people don't have symptoms from birth. Instead, it seems like there's some type of mechanical shift that happens, like the diaphragm gets pushed slightly one way or the other, and suddenly you start having symptoms. Most people who develop MALS are young women in their teens or 20s, so that was one reason why Matt's case was atypical, but it can affect men and it can occur later in life. When symptoms begin, what do they look like? The main symptom is stomach pain, but the stomach pain can come from two different sources. One source is the compression of the celiac artery, which reduces blood flow to your organs. This is called ischemia. And if that's the main factor, then you have intense pain right after you eat. This is because after you eat, your stomach is going to demand more blood flow, and if the celiac artery can't provide that, it causes this severe pain. Matt didn't have that type of pain. His abdominal pain was ongoing and constant and didn't seem to have any relationship to when he had eaten. The other source of the pain from MALS is nerve pain from the celiac plexus being compressed, and Matt's symptoms did fit with that type of pain. For one thing, his pain had a strong positional dependence. Anytime he tried to lie on his side, the pain got a lot worse. And this was a big psychological factor for him because this is how he normally sleeps, is on his side. So this was another way that Matt's case was atypical. For most people with MALS, their pain is at least partially due to the ischemia, and so it is associated very much with eating. At first, the doctors working on his case didn't think MALS was a likely diagnosis, partly because he didn't look like your typical MALS patient. Most of the people who get diagnosed with MALS, in addition to being young women, are also super thin. And that's because in most cases, it's taken them a really long time to get this diagnosis. And in the meantime, they've developed a strong aversion to eating because of the pain involved. Most of the time, unfortunately, people who have been suffering with this condition go months or years before they're able to get a diagnosis or treatment. We even read about some extreme cases where people had been on a feeding tube for years with no answer why they weren't able to eat. Once we learned about MALS, it did make me wonder if it had ever caused any symptoms in the past. Specifically, there was that week in Maryland last spring on the ADT. Matt had to come off the trail for about a week because he was feeling generally horrible. He had weakness, nausea, maybe a little bit of stomach pain, but he had no objective signs. And when he went into the doctor, his test results were all negative. Matt thinks that could have been caused by a trace pollutant in the water, since he had recently drunk out of the Potomac River and some questionable side streams. That doesn't really make sense to me. But his symptoms during that event don't really track with MALS either. There was no severe stomach pain, and again, no correlation with eating. So, assuming that Matt was indeed suffering from MALS, and we think that he was, it's really kind of a miracle that he was able to get diagnosed and treated so quickly. Part of that was because of the unusual severity of his pain that forced him to go into the hospital and meant that going through the normal slow process of progressing through tests and doctors one at a time wasn't an option. And another big part was being lucky enough to be at Scripps La Jolla. This was a really good hospital. The doctors had the expertise and the consideration to, number one, be aware of this possibility, and number two, put in the time and follow through to do the workup for it. Thanks to Scripps Hospital and the doctors there, Matt was able to get the MALS surgery within 2 weeks of the onset of his pain. What they do is basically make a cut in the ligament to relieve the pressure. This allows blood to flow freely through the celiac artery, and also, more importantly for Matt, stops the irritation to the celiac plexus nerves. We asked extensively about any possible side effects of the surgery, and thankfully they aren't many. Maybe an increased risk of acid reflux, since the surgery is disturbing the connective tissue that's part of the anti-reflux barrier, but that's a pretty minor thing that many people are going to get later in life anyway. As an added bonus, the surgeon did a hiatal hernia repair during the same operation. A hiatal hernia is where your stomach, which is normally right underneath your diaphragm, is sticking up a bit through your diaphragm and into your chest. This is a fairly common thing that happens, especially as people get older, and it's not a huge concern on its own, but it can cause some problems. Interestingly, it occurs disproportionately in MALS patients for a reason that aren't well understood, but probably have to do with subtle changes in anatomy within your abdomen as a result of the pressure from the arcuate ligament. The surgery went smoothly. Right after the surgery, the main abdominal pain he had been experiencing seemed to be gone. The recovery time for this is typically 1 day in the hospital, 1 week at home with someone helping to take care of you, and then a month before it's safe to return to full activity, including using your core muscles again. We were both really hopeful at that time that the worst was over, and that after 1 short month of recovery time, we would be off to canoe the Yukon River. Unfortunately, just a few days after being discharged from the hospital, Matt started having additional rounds of symptoms. He once again got severe abdominal pain, although it seemed to be in a little different spot, and he wasn't having that positional dependence with it anymore. He also was having some pretty severe inflammation symptoms, petechiae, which are little red spots all over his feet and legs and a little bit on his arms, joint pain in his ankles, knees, wrists, and knuckles, and swelling in his knees, ankles, and feet. During the worst episode, the pain could be managed by lying down and elevating his feet, but any attempt to stand or even just swinging his legs off the bed so they became a little bit vertical resulted in excruciating pain. Pretty soon, the abdominal pain was unbearable enough that he ended up back in the hospital. This time, the new symptoms triggered a different set of doctors to work on his case, including a rheumatologist, a dermatologist, and an infectious disease doctor. The closest match for his symptoms was something called IgA Vasculitis, also known as Henoch-Schönlein purpura, or HSP. HSP is an autoimmune condition where, for some reason, your body's immune system has gone into overdrive and is targeting your own small blood vessels. The intestines are especially sensitive to this because of how dense the vessels are there. The inflamed blood vessels make the intestines swell, which causes the horrible abdominal pain. At the same time, anywhere you tend to put pressure, like mainly your feet, the capillaries can start to leak blood into the surrounding skin, which is causing the petechiae. Once again, the doctors were a little hesitant about this diagnosis because he is very much not a textbook case of this condition. The condition usually affects children, and usually the rash is the dominant symptom, and the abdominal pain is a secondary symptom that comes and goes. For Matt, the abdominal pain was the consistent symptom, and the rash was more minor and came and went. There was one attack where the rash was really severe and was covering his whole lower legs, but the other couple times it happened, it was mostly just on his feet. They ran just about every blood, urine, and stool test they could on him, though, and weren't able to turn up anything else. And when they eventually did biopsy the rash, they found immunoglobulin A deposits in the blood vessels, which pretty much confirmed the HSP diagnosis. So how is it possible that Matt got these two very rare conditions, one right after the other? It's just too much for me to believe that it was just a coincidence. One possibility is that the MALS diagnosis was a mistake, and the abdominal pain was caused by HSP all along. He did have a really bad round of bronchitis a couple weeks before the onset of the pain, and HSP is sometimes triggered by respiratory infections. That would be really unusual for HSP to manifest in that way, with the abdominal pain hitting so much earlier than the rash. As the doctor described it, usually the rash is the external mirror of what's happening internally. We also don't really want to believe that's what happened, because that would mean Matt had an unnecessary surgery, which is a scary thought. And the fact that the nature of his pain changed after the surgery does suggest that they were two separate conditions. However, we'll never really be able to know for sure. Another possibility is that the bronchitis and all the coughing caused his diaphragm to shift mechanically, triggering the onset of MALS. Then, during the course of his 2 surgeries, because he had a diagnostic laparoscopy a few days before the MALS surgery, one of the anesthesias or other medicines he was on triggered his immune system to go into overdrive, leading to HSP. I looked and couldn't find a single recorded case of any patients developing HSP right after MALS surgery. However, there is a concept called the second hit phenomenon, where patients that go through 2 traumas to the body, like 2 repeat surgeries in close succession, are more likely to develop new health issues. Basically, the body is under extreme stress at that point, and so is much more likely to develop issues in several body systems, including the immune system. The good news is that there is a set treatment for HSP that leads to a full recovery. Right now, Matt is on prednisone, which is a steroid to prevent the massive inflammation, and Cellcept, which is an immunosuppressant. He's responding well to the treatment so far as not having any additional abdominal pain. Unfortunately, the side effects of those medicines are pretty severe, and he's probably going to be on them for another 2 months. But at the end of the day, we're really grateful for modern medicine in general, and for Scripps Hospital and all the doctors and nurses there in particular for following through with him on a really tricky and unusual case. Over the months, here we go. Over the months, oh, shoot, don't smile, okay.